Most men think erections are all about arousal and blood flow, but behind the scenes, there's a whole system of muscles, nerves, and internal coordination that makes it work. Or not. That's why many urologists today no longer jump straight to pills. Instead, they recommend targeted, physical routines that restore function at the root level. Because after 50, biology changes, and performance needs more than chemistry. I'm Dr. Isabel Lopez, a urologist with over 25 years of experience. And where are you watching from? Drop it in the comments and stick around because I have a surprise for you at the end. In today's video, we're going to talk about something few doctors explain clearly: how stretching and muscle activation can improve erectile quality naturally and safely without relying on medication. As men age, the pelvic floor muscles weaken, circulation slows down, and nerve compression becomes more common, especially in the lower back and hips. These subtle changes affect more than mobility. They directly impact erection strength, stamina, and even ejaculation control. But here's the good news: the body responds fast when you target the right areas. Stretching, when done with intention, can improve blood flow, increase nerve sensitivity, and activate the deep muscles responsible for rigidity and control. And no, you don't have to become a yoga master. This is about specific, urologist-recommended movements that restore the foundation of male performance. In this video, I'll guide you through 5 essential stretches designed to support better erections by unlocking tight areas, improving pelvic alignment, and strengthening the muscles involved in sexual response. These are simple, low impact, and you can do them right at home. So if you've been searching for a natural way to improve performance, boost stamina, and regain control, you're in the right place. Follow the channel so you don't miss what's coming next. Erections aren't just about arousal, they're about anatomy. At the core of every strong erection is a network of pelvic floor muscles, key blood vessels, and one especially important nerve, the pudendal nerve. These elements work together to allow blood to flow, pressure to build, and signals to travel. When even one part is restricted, the whole system struggles. Over time, the muscles that support this system, like the levator ani bulbospongiosus and ischiocavernosus, can weaken from disuse, poor posture, or prolonged sitting. This affects the force and duration of erections, along with control over ejaculation. Stretching doesn't just increase flexibility, it helps re-engage these muscles, improve neuromuscular coordination, and remove blockages in flow. One of the most overlooked factors is nerve compression. The pudendal nerve travels through tight areas of the pelvis, and when surrounding muscles or fascia get stiff, the nerve gets irritated. This results in reduced sensitivity and poor signal response. Stretching specific regions like the hips, lower spine, and abdomen can relieve this compression and improve nerve mobility. Then there's the vascular piece. For an erection to happen, blood vessels must dilate, a process heavily dependent on nitric oxide. Stretching improves circulation by relaxing arterial walls and enhancing the body's ability to produce nitric oxide naturally. It's like opening a faucet. Once the tension is gone, the flow increases. This combination of better mobility, stronger muscle engagement, and freer nerve pathways creates a foundation for not just better erections, but more reliable and longer-lasting performance. And it all starts with activating the pelvic region properly through movement, not medication. In the next section, I'll walk you through 5 specific stretches urologists are now recommending to men over 50, each one designed to support the anatomy you've just learned about. Now that you understand the connection between movement and performance, let's get practical. These 5 stretches were handpicked for their ability to target the deep pelvic structures involved in erection strength, control, and endurance. They are safe, effective, and designed specifically for men over 50 who want natural results without complex routines or gym equipment. Start with the pelvic tilt. Lie on your back, knees bent, feet flat. Slowly tilt your pelvis upward, flattening your lower back into the floor. This subtle motion activates your deep core and pelvic floor muscles while resetting pelvic alignment. Hold each repetition for a few seconds, focusing on control. Aim for 10 to 15 slow representatives. Next is the prone stretch, also known as the Sphinx or Cobra pose. Lie on your stomach, elbows under shoulders, and gently lift your chest while keeping hips grounded. This decompresses the anterior pelvic fascia, improves spinal extension, and opens space for circulation to flow freely. Hold for 30 to 60 seconds, breathing deeply into your abdomen. Then comes the kneeling abdominal draw-in. Kneel on all fours, exhale fully, and pull your belly button in toward your spine without moving your back. Hold the contraction for 5 seconds, then release. This sharpens the connection between your abs and pelvic floor, reinforcing the neuromuscular control that supports erection stability and ejaculation control. Now, the hip opener stretch. Sit on the floor, bring one ankle over the opposite knee, and gently press the bent knee downward. You'll feel a stretch in the glutes and groin. Tight hips restrict blood flow to the genital area. This movement restores it. Hold for 30 to 60 seconds per side, staying relaxed and controlled. Finally, the supine bridge hold. Lie on your back, bend your knees, and lift your hips toward the ceiling. Squeeze your glutes and hold at the top. This exercise activates the glutes, core, and pelvic floor in one unified movement pattern. It reinforces the same muscles involved in maintaining rigidity during sex. Stick with me until the end, because what I'm about to share might truly change your life. And don't forget, I've got a surprise waiting for you at the very end of this video. The power of these stretches lies not only in the movements themselves, but in when and how you do them. Timing matters. Performing them in the morning can wake up your pelvic floor, enhance blood flow, and set a strong tone for the rest of the day. Doing them in the evening helps release tension built up from sitting or stress, promoting better overnight recovery and performance. To amplify the effect, incorporate pelvic floor contractions, commonly known as Kegels, during or immediately after each stretch. These help train your body to engage the exact muscles responsible for erection control and ejaculation timing. You don't need to overdo it. Start with 5 to 10 representatives, holding each for about 5 seconds, and build up as your strength improves. Consistency is key, but so is synergy. When you pair these stretches with low-impact cardiovascular activities like walking or swimming, you create a powerful circulatory loop. Add light strength training 2 to 3 times per week, especially for legs, core, and glutes, and you'll reinforce hormonal health while supporting muscle tone where it counts. Breath control also plays a critical role. Deep, slow breathing during each stretch stimulates the parasympathetic nervous system, reducing tension and improving circulation. This helps shift your body out of stress mode, which is essential for hormonal balance and sexual readiness, especially as you age. As your mobility improves, you can progress by increasing stretch time, repetition volume, or even adding resistance where appropriate. The goal isn't just flexibility, it's restoring pelvic function, nerve activation, and vascular performance in a way that lasts. Track how your body feels, and don't rush. This is a long-term investment. In the final section, I'll show you how these 5 movements, combined with a few key habits, can completely transform your confidence and stamina naturally from the inside out. These 5 urologist-recommended stretches aren't just about flexibility, they are about restoring function. When done consistently, they retrain your body to support blood flow, reawaken dormant muscles, and release the physical restrictions that silently undermine performance. It's a shift from passive treatment to active control, and it starts with just a few minutes a day. We covered movements that target the core of male sexual function, the pelvic floor, glutes, hips, and abdominal wall. You've learned how to realign the pelvis, decompress pressure points, and enhance the neuromuscular pathways essential for erection strength, stamina, and control. The key isn't complexity, it's precision and repetition. This routine is more than just rehab. It's a proactive protocol for reclaiming virility without relying on pills. And when combined with quality sleep, clean nutrition, consistent movement, and regular medical checkups, the results often exceed expectations. Your body still knows how to perform. You just have to give it the right tools. Before we dive in, I want to share something special with you. I've created a 21-day challenge specifically designed to help men over 50 restore stronger, longer-lasting erections through simple daily movements and breathing techniques. If you're serious about improving performance naturally, don't wait. Grab your copy of the ebook now. The link is pinned at the very top of the comments. It's time to stop relying on short-term fixes. Your performance is something you can train, strengthen, and sustain, just like any other part of your health. These 5 stretches are a powerful place to begin, and with daily commitment, you'll notice more than just physical changes. You'll feel more confident, capable, and in control. Join the Members Club. Drop a super like, follow the channel, and leave a comment. Your story might inspire another man to take the first step toward real, lasting change.